good evening, and welcome to this special edition of a Facebook Live here on blackdoctor.org. I am Ellis Dean, of course, and I am the Director of Digital Programming and Production here at blackdoctor.org, and I am excited to bring this program in conjunction with the National Black Nurses Association and the National Medical Association for you tonight. Because understanding this, we are still in the middle of a pandemic. This is year three, beginning year three. I can't even wrap my mind around how long we have been a part of this pandemic. And it doesn't seem like it's going away, but we still have a fight. And we still have people are dying. We have recently crossed the 900,000 death mark here in the United States. 900,000 people have succumbed to complications related to COVID-19. And we also know that we have some very effective vaccines that are available to us, but many people still haven't made that decision to get vaccinated, particularly in our community. And so we are bringing you this presentation tonight to get you the information that you need. So we have a wonderful doctor on with us tonight. I'm going to give you her information because she's phenomenal. So just take my word, she's phenomenal. So this is Dr. Khalila Brown. She's a native of Huntsville, Alabama. I love my Southern folks. And received her BS in biology with honors from the University of Alabama in Birmingham and her Doctor of Medicine from the University of Alabama School of Medicine. She completed her pediatric residency training with the University of Florida at Sacred Heart Hospital. After completing her training, she participated in the National Health Science Corps at Quality of Life Health Services in Gaston, Alabama. Dr. Brown joined Jefferson County Department of Health as a public health medical officer in 2009 and was promoted to child health medical director in 2016. In 2018, Dr. Brown also assumed the role of laboratory director for Jefferson County Department of Health. Dr. Brown is a 2019 graduate of Leadership Birmingham, serves on the Children of Alabama's ACE Committee, the YMCA of Greater Birmingham Health Advisory Committee, chairs the Maternal Health Child Health Roundtable of Jefferson County, co-chairs the Health Action Partnership Healthcare Access Priority Group, and services on the board of directors for the Community Food Bank of Central Alabama. Dr. Brown is very accomplished, and she has a wonderful presentation tonight to talk about vaccines, particularly as it pertains to children. So let's bring her on. Good evening, Dr. Brown. How are you?
Good evening. I'm great. How are you?
I am doing well. So I hope I did you some justice because you've got a lot going on. So it's.
I appreciate the kind words.
Absolutely. So I don't want to hold anybody up because I know they're here and I know you've got a wonderful full presentation for everybody tonight. So we're going ahead and get that started. People, I want to just say again, number one, let us know where you're watching from. So drop that in the comment section. So we like to know where people are watching from all over the country, all over the world. Number two, if there's some if you know somebody that needs this information, please tag them and share this with them because we're trying to get this information out to as many people as possible. And number three, if you have any questions, please drop that in the comment section because at the end of Dr. Brown's presentation, we will be answering some of your questions that come up throughout the presentation. So please share it, like it, tag a friend, ask your questions. That's it. You ready to go, Dr. Brown?
I'm ready to go.
All right.
All right. So we're going to discuss changing the world one vaccine at a time. I will just go ahead and give you the caveat that I am not a historian. I'm a pediatrician. Science is my first love. But I will say with this pandemic, as we got further into it and there was a lot of misinformation, I thought back to things that I was told as a child of, knowing your history is so important to not only know where you're coming from, it can help you understand the direction you need to go in. And so that really inspired me to start looking at pandemics back in our history and vaccines. As a pediatrician, I give lots of vaccines. I recommend them to parents and children. But knowing the history of that, I think is so strong and so important and can help us put some of these things around COVID-19 in perspective. So we'll advance to the next slide. Let's see. I have no financial disclosures. We can continue to advance. So if I've done my job by the end of this, you will understand the history of vaccination in the United States, the impact of vaccines on history and public health. We'll talk a little bit about herd immunity. We're going to review current pediatric vaccines, why they were developed and their impact. Hopefully that will help shape some of where we're going with COVID. We'll talk about some current COVID trends from the United States down to where I currently am in Alabama. And then we'll talk about some vaccine strategies for overcoming vaccine hesitancy for those who are providers, maybe nurses, even those people in the community, if you are talking to friends and family, how to address that with them. So next slide. So if you've been to the doctor, taking your child to the doctor, ever received childhood vaccines, or if you're a provider that gives vaccines, you likely recognize this slide here. This is our current CDC recommended immunizations for children birth through age 6. Currently, from birth to age 6, we give 14 different vaccine components. And the first we give, actually, before the child is discharged from the hospital, we give a hepatitis B vaccine. And hepatitis B vaccine is actually one of those vaccines that is a cancer prevention vaccine. And so we'll talk about that a little bit later. But understanding that we give lots of vaccines in the first 4 years of life, basically to prevent lots of diseases that have ravaged our country and the world in the past through pandemics and epidemics. And so we give a lot of these vaccines now in conjunction with other vaccines and combos to lessen the number of shots that children have to give. But it's imperative that our children get these vaccines so that they don't get the diseases that these vaccines prevent. So my children and the children in their generation don't even know what a lot of these diseases look like because we give these vaccines. So we'll advance to the next slide. So this next slide is our CDC recommended vaccines for children 17 to 18. And if you'll notice here, the Tdap is a booster dose for something that we gave earlier on in our last slide. And then you'll see that there are some adolescent vaccines that are added on, including HPV and those around meningococcal disease that we'll discuss as well. Next slide. So this is one of my favorite quotes about history. Although I'm not a historian, I think this is so pertinent to where we are right now with COVID-19. And George Santayana said, "Those who don't learn history are doomed to repeat it." So we're going to talk a little bit about those who came before us in the history of vaccines and who kind of laid the path for where we are today. Next slide. So an ounce of prevention is worth a pound of cure. That was Ben Franklin who said that, but we say that a lot in pediatrics because most of what we do in pediatrics is prevention. It's not disease treatment, it's prevention. We're trying to keep our children healthy and preventing them from getting diseases. So most people understand that vaccines have been around for a very long time, but in 1796, Albert Jenner actually discovered the smallpox vaccine. And he discovered that milkmaids who were exposed and developed cowpox did not get smallpox. So he actually coined the term vaccine. It came from the Latin term vacca, which actually means cow. And so about 100 years later, Louis Pasteur, who most people know for pasteurization of milk, came along, but most people don't realize that he's also known as the father of microbiology and the father of bacteriology. And he helped discover vaccines for rabies, cholera, and anthrax, things that my children have never seen or likely even heard of. In the 1950s came along Drs. Jonas and Dr. Sabin, Dr. Jonas Salk and Dr. Albert Sabin. They did integral work in polio. And then at the bottom here, you see Dr. Maurice Hilleman. He and his team, through the course of about 30 years, actually are responsible for over 40 vaccines. 8 of those are currently on our recommended routine vaccine schedule that I just showed you. Next slide. So let's talk a minute about historical pandemics and epidemics. A lot of us have not lived through a pandemic that this to this scale, but understanding that when the Europeans came over to settle in the Americas, they brought smallpox with them in the 16th century. And it's noted that about 70% of Native Americans died due to smallpox that was brought to the Americas. In the summer of 1793, there was a yellow fever epidemic in Philadelphia. And in that summer, Philadelphia lost over 5,000 people in one summer. We've also had a cholera pandemic. It was in New York between 1832 to 1866. It was estimated that anywhere from 2 to 6 people a day died in New York from cholera. And if you can think about what the population of New York was in 1860s, 2 to 6 people a day is a lot of people. So then we move forward to 1906 to 1907 is typhoid. A lot of people hear the stories of Typhoid Mary. Well, she was a real person. She was a cook in New York who was actually an asymptomatic carrier of typhoid. And so we hear about a lot of that in COVID-19, asymptomatic carriers. Well, it's not a new term. Typhoid Mary was responsible for a lot of the transmission of typhoid. And she was actually quarantined alone on an island twice for a total of over 25 years to prevent the spread of typhoid. So quarantining is not a new topic, not a new thing, and it's been used to prevent the spread of disease. In 1918, this is when we talked about the flu pandemic in 1918. People know it to be the Spanish flu. If you look at the picture at the top right, that is actually Americans in 1918 who were masking to prevent the spread of Spanish flu. So masking is not new. It was something that was used back then. Over 675,000 Americans died from the Spanish flu in 1918. We've had a diphtheria outbreak in 1921 that caused over 15,000 deaths. And then if you look at the photo at the bottom of the screen, that is the 1937 US polio outbreak. And that is children in Chicago who actually schools closed and they're learning over the radio. So closing schools in a pandemic is not anything new either to prevent the spread and to protect our children. Next slide. So in the 1960s, US rubella epidemic, we had over 12.5 million cases of rubella. We had over 20,000 children born with congenital rubella syndrome defects. We had over 2,000 neonatal deaths and over 11,000 miscarriages in pregnant women. In the 1980s, specifically 1989 was the peak of the US measles outbreak. Back in the early 1900s and 20th century, we averaged about 6,000 deaths a year from measles. And in the 1960s, measles was actually so common that most children by the age of 15 had contracted measles. But what most people don't know about measles is that it's very significant. It can cause significant disabilities. It can cause death. And so between 400 to 500 people a year died at the time, 48,000 hospitalizations a year. There were children who suffered from what's called encephalitis or swelling on the brain from measles. And so the US government got involved. You've heard a lot about the ACIP or ACIP committee around COVID-19. Well, they were around active at this time as well. And they really helped push and spur measles vaccinations. We had a lot of measles hesitancy, measles vaccine hesitancy. So even though the vaccine had been around since the 60s, we were still seeing children die and be hospitalized in the 80s and into the early 90s from measles. And so that's when the ACIP recommended that we have a second dose of the MMR vaccine. So again, coming out with one vaccine and needing a second dose and then needing a booster dose is not new. to us when we discuss vaccines. In 1981 to 2005, of course, we all are very aware of the AIDS HIV epidemic. We've lost over 600,000 Americans to HIV/AIDS. We still have no cure. We have very effective treatment, but so pertinent to what's going on with COVID-19, especially in our community, the misinformation around treatment still today prevents us from getting treatment to those who need it. We actually have very effective prevention that can prevent you from getting HIV and AIDS, but getting around that misinformation and getting the information in the hands of the people who need it is very important. And so we're still struggling with that in the United States today. And then in 2009, we had the H1N1 flu epidemic that sent thousands of Americans to the hospital. We had over 22 million infections that year. We had 98,000 hospitalizations and over 4,000 Americans died. So we're going to put that in context to where we are currently with COVID-19. But first, we're going to talk a little bit about herd immunity. Next slide. So this is my favorite slide from the CDC that talks about and helps you understand herd immunity. I use this a lot with children in my clinic and when I give talks because it's such a great illustration and easy to understand. So the red dot is the infected person, and you can follow disease spread through the red arrows. And so those blue dots are your vaccinated individuals. Those gray dots are your unvaccinated individuals. So you can see where there's no herd immunity, the red dots are allowed to flow through and continue all the way through the diagram. So understanding herd immunity has been one of those things I think in our community that there's been a lot of misinformation and lack of understanding around what true herd immunity is. And so this really has to do with when a large enough population, a part of the population is immunized so that most members are protected even if they're not immunized. And the reason for that is there's little opportunity for an outbreak. So diseases that are contagious like measles and flu, rotavirus, pertussis, and COVID-19 really need a good herd immunity to stop the spread. On the right side, you see, again, that red infected person, but you only see one arrow for disease transmission. And that's because there's enough blue dots, there's enough vaccinated people in the community that prevent the spread. And so you even see that one gray dot all the way to the right that is unvaccinated, but they don't end up being infected with the disease because they are surrounded by so many vaccinated people. That is herd immunity. Next slide. So this slide is just to kind of show you about herd immunity, and we've talked a lot about how much we need to get to, what percentage people that we need vaccinated to get to herd immunity, and that is always dependent on how contagious the disease is. So the Omicron variant of COVID-19 is as contagious as the measles virus. So you see that at the bottom. And what that R0 tells you is for one person, they can infect 12 to 18 people at a time. And so for herd immunity, we have to have somewhere between 83 and 94% of the population vaccinated against measles to prevent that continued transmission. So I want you to keep that in mind as we talk about COVID-19 and where we need to be. Next slide. So we're just going to go through
hold on, I quit there,
our routine childhood immunizations very quickly. These are the vaccines that we give to all children beginning again at birth. And most of them have these vaccines by the time they're somewhere between age 4 and 6. So diphtheria is a bacterium that causes significant disease, and at one point in time caused about 15.5 thousand deaths in the United States. And so we now immunize against that disease and don't see it. Tetanus is another one that we talk a lot about around wounds. You hear about tetanus, but most people don't understand. They think it's large wounds. It's actually the small wounds that will get you in tetanus. It's because large wounds we tend to get seen and treated for. We keep them clean, but it's those small wounds that we just really don't pay attention to, and that can cause tetanus. And understanding that tetanus can be fatal in 10 to 20% of people But if you're vaccinated against tetanus, we need vaccines every 10 years. It is effective about 100% of the time. And then pertussis, we hear about that. It's whooping cough is what you hear about. We do have a vaccine for that, but worldwide, because of lack of vaccines in third world countries, there's still 89,000 infant deaths due to pertussis in 2021. Vaccine is 80% effective for 5 to 10 years. And we now give the vaccine to adolescents because we found that they have waning immunity, another term that we talk about in COVID-19, that waning immunity and why you need to get that booster. And we also give it to pregnant women in their third trimester because we want to make sure that pregnant women don't get it and then pass it along to their infants, which is something else we're seeing in COVID-19. Next slide.
So if you're just joining us, we are with Dr. Brown, and she is doing a presentation on basically the history of viruses and vaccines, bringing us up to the current and what we're dealing with COVID-19. And so I hope you're paying attention. So if you're just joining us, I'm sorry you have to go back and replay this presentation, because it really does provide some context about where we are. We're not just in a vacuum here in a silo with regards to having dealt with pandemics, understanding vaccines and how we're vaccinating children and everything else. So please understand that what we're not, even though we're trying to act like it's new, what we're dealing with right now is not new. So if you're just joining us, go back and watch that at another time, but we're having a wonderful presentation here with Dr. Brown. So I just got to get that reset there for you. Sorry about that, Dr. Brown.
It's okay. Next slide. So polio, it's big in my parents' generation. In the 40s and 50s, thousands of children were paralyzed and died from polio. You see the top picture is a girl who now has to use crutches to walk due to polio. There's a picture of our famous president, Franklin Delano Roosevelt, who actually developed polio as an adult and needed the assistance of a wheelchair. And then that bottom picture is actually a more recent picture of a child in areas that still deal with polio to this day. And so they are being vaccinated with the oral polio vaccine, which is what the World Health Organization uses to vaccinate worldwide. We typically use IPV, which is an injection for polio in the United States, but understanding that there's still no cure for polio, prevention is key. And so having our children immunized is so important. Polio has been eliminated from the Western Hemisphere since the 1990s due to vaccination, but it's still seen in some Eastern endemic countries. And again, that's why you see that the World Health Organization is still getting out vaccines, trying to get them to herd immunity, to get them to where we are in the Western Hemisphere. Next slide. So measles, mumps, rubella. We hear a lot about the MMR vaccine. It actually became a combo vaccine in the 1970s. But prior to that, they were individual vaccines. So measles spread through respiratory droplets, very similar to COVID-19, how it spread. That top picture is a picture of a child with measles. It is, again, extremely contagious. And so we liken that to how contagious the Omicron variant is. Again, no treatment for measles as well. And we still, in the 2000s, lose 1.1 million children globally to measles just due to poor vaccination rates in third world countries. We did actually have a measles outbreak in the United States in 2019 due to declining immunization rates and children coming over who were not vaccinated. We had a record of about 1,200 cases of measles that year, and that was the highest we had seen it in over 20 years. Cases of mumps, you see the child here with the swelling around his jawline. That is mumps. It's also spread through respiratory droplets. Dr. Hilleman also discovered that vaccine. We talk a lot about, you've heard a lot about fertility and things around COVID-19. Well, mumps is one of those things that can affect your fertility. It can cause inflammation of the testicles or the ovaries and affect a child's future fertility later on. It can also cause deafness in children as well. And then rubella is that bottom picture. It's a mild disease typically in children, worse in adults, yet we vaccinate for it in children. Why is that? So with moms, if they are infected with rubella, they can have significant miscarriages. Their infant can be born with significant birth defects, or their infant can die relatively early on in life. And so we prevent this disease from spreading by preventing those who can pass the disease along, which would be children who are being taken care of by their pregnant moms. So this was declared eliminated in the United States in 2004, but we still see it in the world. Next slide. So Hib is another vaccine that we give our children. It is a bacterium. It is Haemopolis influenza, a lot of times confused with the influenza virus. It is not related, but it can cause significant disease, including meningitis. It can cause our children to have deafness and other neurological defects, and it can be fatal 2 to 5% of the time. So we do have a vaccine for it that was developed in 1985. But in Pennsylvania in 2008, in October, we had an outbreak of 7 cases and 3 pediatric deaths. And of those, only 1 of those children were vaccinated. So again, highlighting the importance of vaccinating our children against diseases that can harm them. Next slide. Hepatitis A and B are other viruses that we vaccinate against. There are several types of hepatitis, but currently we only vaccinate against A and B. Hepatitis can cause acute illness with vomiting, diarrhea, liver inflammation, liver failure, and about 1% of the cases will go on to develop liver cancer. So again, hepatitis B is that first vaccine that we give our children when they're born to prevent maternal transmission, or moms being able to give babies hepatitis B through the birth process. And so that's another thing we talk about around COVID-19. Moms who have COVID-19, even if they're asymptomatic, being able to give their infants COVID-19 when they are born. Again, we've had those vaccines since the 1980s, and we continue to deal with these diseases in the United States. Next slide. So varicella chickenpox. It was the most common childhood disease in the 1980s. I don't think I knew a child growing up in the 80s who didn't have chickenpox, but I can say because of the vaccine, my children have never seen a case of chickenpox. I have a picture at the bottom of an African-American child with chickenpox. And I put that here because a lot of times African-American children were diagnosed later or in the disease course, because you don't have that typical kind of red inflamed look that we would always see in the textbooks with chickenpox. It looks different on melanated skin. And so understanding that was something that affected our community, but now our children don't see it because they're vaccinated. The other thing that, we're hoping that we will see and that we should see is that children, if they don't get chickenpox, then they will not get shingles as adults. So as our generation and our parents deal with shingles and how debilitating that can be, our children will now not have to deal with shingles because they never had the initial case of chickenpox to begin with. So we'll go to the next slide. Pneumococcal, it's a bacteria. This is what you hear about when people have pneumococcal pneumonia. It can cause significant disease and death. It can also cause meningitis. It can cause you to have bacterial sepsis. It is another one of those things where people can be asymptomatic carriers. Again, not a new term, but those at-risk individuals, those under 2, immunocompromised, those with sickle cell disease, people who have cochlear implants to be able to hear, they are at risk to those people who are asymptomatic carriers. And so we vaccinate against it. We have adult vaccinations, and then in the early 2000s, we came out with a vaccination for children. So we now routinely vaccinate children against what's 13 types of pneumococcal, which is the PCV13 vaccine. Next slide. So the next one is influenza. Most people know this one. We talk about it every year when we talk about seasonal flu. Pneumonia is the most common complication. It's estimated that 8% of the US population get sick from flu every year. But understanding that children under 5 are very vulnerable, and somewhere between 7,000 to 28,000 children a year are hospitalized with flu. So it's so important that we immunize against flu so that our most at risk, again, those younger children, our older adults, those with asthma, and those who are pregnant. Again, things that we've heard through COVID-19, very similar with the flu. We immunize our population so that we can protect that most vulnerable population. Next slide. So rotavirus is our only oral vaccine that we give. Rotavirus still kills about 450,000 children globally from severe watery diarrhea. But the vaccine prevented 55,000 hospitalizations in 2008. That was just 2 years after the oral vaccine came out. So just showing you what an effect that vaccines can have very quickly when we give them, and we give them effectively. Next slide. So HPV, this is one of our newer vaccines when we're really trying to get ahead of misinformation. Again, something we've seen with COVID-19. This is something that has hampered us with HPV. But HPV is, the vaccine is really about cancer prevention. 80% of women in the US will be infected with HPV by the age of 50 if they're not vaccinated. HPV, 2 main strains, 16 and 18, cause about 70% of cervical cancers. So vaccinating our children will then prevent them from getting these cancers later on in life. There's also cancers that you will see in males, including rectal cancers. So the vaccine was approved in 2006. There's over 150 types of HPV, and we currently vaccinate against the 9 most prevalent types that cause disease. Of those vaccinated, we've seen decreased infection rates by 64%. That's huge. Next slide. So meningococcal disease. This is one we talk about around our teenagers and most importantly, our children who are going to college. So if you're a parent of a child who is in high school or going off to college soon, this is one you really want to make sure that you talk to your provider about. Those who are most at risk are infants, teens, and young adults, and that's due to close contact. That's how it's spread. The thing about this disease is that it comes on very quickly and can kill you very quickly within hours. So we think about our teenagers who congregate in groups or who live in dormitories. A lot of times you may not talk to your child who's in college on a day-to-day basis. And so this disease could come on very quickly before they realize how sick they are. And kill them very quickly. So immunizations are so vital when we start talking about this disease. Again, 1 in 10 people can be carriers, meaning that they have it, but they are asymptomatic. So your child could room with someone in a dormitory who is a carrier and then potentially contract this disease if they are not immunized. It is not rare, but when you get it, it is severe and can be very fatal. All right, so now we get to COVID-19. We've talked about all these diseases that we vaccinate our children against. So now let's talk about COVID-19. So as we talked about at the beginning of the broadcast, we're now entering year 3 of COVID-19, a full 2 years. March 2020 is when we declared it a global pandemic. As of January 28th, we had just under 900,000 deaths. We have now surpassed that in the United States. Now, just less than 2 weeks later, we are over 900,000 deaths. The vaccine was developed again in 2020. You hear a lot about Operation Warp Speed. One of our vaccines did come through Warp Speed. One that is authorized did not. And it is under emergency use authorization. It became under emergency use authorization in November of 2020. So we have now been given this vaccine for a little over a year. And we gave it in a stepwise approach. We started with our healthcare workers and those who are most vulnerable, so those 75 and older. And we've progressed as the data has come out. The thing about the COVID-19 vaccine is it has been the most scrutinized vaccine ever in history. We have followed this vaccine so very closely through the FDA, the CDC, and it has played out in real time. Most people in all of those other vaccines that we've seen, although you saw that they were developed probably in your lifetime, you did not hear about them the way you're hearing about COVID-19. So you're hearing about science in real life and the trial and error of science and how we go through and make sure that things are effective and safe. So one of the things that has garnered a lot of misinformation is the mRNA technology. What most people don't realize is that technology has been around since the 80s. It was used mostly initially around cancer treatments. But when COVID-19 hit, it had already been looked at in prior epidemics in SARS and MERS that were prominent over in the Eastern countries. And so there had already been a lot of research around it, which is why we were able to develop a COVID-19 vaccine so quickly. This vaccine is great for COVID-19 because it's easy to replicate. It comes in and does what it's supposed to do, and then it's excreted from your system. It does not stay in your DNA, does not change your DNA. It does not even stay in your body. Your body breaks it down and excretes it. So what the mRNA vaccine actually does, the COVID-19 vaccine does, is it codes for a protein. If you look at the little red spikes on the diagram there, those are what's called the spike protein, and that is seen in all SARS-CoV viruses. So the COVID mRNA vaccine codes for that protein, and so then your body recognizes that as being foreign, and it mounts an immune response. And then again, it breaks down that vaccine and it's excreted from your body. But what that does is it's basically giving your body, it's immunized your body. It's given it the code to what it needs to do to then fight off when you actually see the COVID-19 virus. So it's really neat technology. It's worked very well, as we've seen. Our first two vaccines that came out were over 95% effective against the original strain of COVID-19. We now have millions of people in the United States vaccinated, but we have a ways to go. Currently, those 12 and up are eligible for a booster vaccine, and those 5 years and up are eligible to be vaccinated either under emergency use authorization or full FDA authorization for those 18 and older. So we'll go to the next slide. This next slide is it's a COVID-19 dashboard put out by Johns Hopkins. You can Google it and look at this real time every day, but it shows the number of deaths that we've seen worldwide. You can go down into it and look at deaths by country. You can even go down into it and look at deaths and vaccines by states. So you can see that we have had worldwide over 5.7 million deaths. 1.5 million children have lost their primary or secondary caregiver to COVID. Everybody talks about Omicron being less severe, and I think we've gotten lost in the fact that we still have significant number of deaths from Omicron. So if you look at this data, it shows you in the last 28 days, we've lost over 252,000 people worldwide from COVID-19. That is the Omicron variant that you hear a lot about. It's just a mild cold, or I was asymptomatic, or I had a sore throat. 252,000 people have died from that disease in the last 28 days. Next slide. So this is our US data. So again, as of yesterday, we had over 905,000 deaths in the United States. 63,000 of those, over 63,000 of those deaths have been in the last 28 days. So what do we need to do about that? How do we prevent these deaths? Vaccines are our way out of this epidemic. Vaccines prevent death. And so if you look over on the right side, you can see our weekly cases. In the red, our weekly deaths are in the white, and then our weekly doses of vaccine administered are in the green. So you see, again, how we talked about when our vaccine came around, we had a large push for vaccination, and then it went down, and then on came the Delta variant and the Omicron variant, and we've seen more and more people get vaccinated. So we just want to encourage people to continue, if you're not vaccinated, to get vaccinated. If you've been vaccinated, to encourage your friends and family members to get vaccinated, because we are still losing people to COVID-19. So next slide. I'm going to talk to you a little bit about Alabama, because this is where I am. This is what I do. We have given over 5.7 million doses in the state of Alabama, yet we still significantly lag behind the rest of the United States in vaccinating our population. If you go to the next slide, we are significantly behind in our 5 to 11-year-olds. We've only vaccinated about 12.5% in the state of Alabama. To put that in context, within the United States, we've vaccinated about a third of children who are eligible. So about 8.7 million children ages 5 to 11, but there are over 24 million children in that demographic who are eligible for vaccines. So getting those children vaccinated is going to be vital to us getting to herd immunity. And then those children who are less than 5, there's about 18 million children in the United States who are less than 5, who are not yet eligible for the vaccine, who are at risk for COVID-19. So understanding that COVID-19 and our children is affecting our children, we are losing our children to COVID-19 deaths. We are losing them to things like MIS-C, which is the multi-inflammatory syndrome in children that causes significant organ damage. It can cause cardiac defects that children will have to live with for the rest of their life. It's also caused significant effects around our children with long COVID, with our children having fatigue, memory loss, short-term memory loss, muscle aches, severe headaches. These are things that I talk to people about, that it's not just about our children surviving COVID, it's about our children thriving through COVID. And so it's very difficult, even though we have our schools open, if our child has long COVID, they're not able to thrive in school because they're not able to think. They're not able to function. Their memory is not operating properly. They're having headaches. They're having insomnia. So it's so important to get your children vaccinated, to keep them out of the hospital, to keep them from having these secondary effects of MIS-C and long COVID. A week in January, the week ending January 21st, it was reported by the American Academy of Pediatrics that we had over 1.1 million children in that week in the United States diagnosed with COVID-19. That's the highest rate of COVID-19 in children that we've seen since the beginning of this pandemic. So understanding that our children are not immune to COVID-19, that they are not untouched from COVID-19, and getting them vaccinated is the way to prevent these secondary effects from COVID-19 and death from COVID-19. We're also seeing significant secondary effects from COVID-19 in that we're having increased obesity rates from our children and their inability to do certain activities, and the way we have to restructure PE to social distance. So vaccination is really important there to get our obesity rates under control. We're having astonishing numbers of depression and anxiety and suicides due to COVID-19. There's recent data that talks about our children who are infected with COVID-19 having over a 2-time risk of developing diabetes post-COVID-19 infection. And so those are things that we need to talk about in our community, that we really need to educate about in our community, understanding that while, yes, COVID-19 deaths are very rare in children, our children are not untouched. And by and large, MIS-C, long COVID, those are affecting African American communities disproportionately. Over 60% of MIS-C cases in the United States are of Latino or African American descent. 60% of those are males. That's our community. Those are our children. And so doing what we need to do to get our children vaccinated and protected is vital to getting us out of this pandemic and getting us to where we need to be, so that we can, at some point in time, talk about this pandemic in a historical context, the way we did about the pandemics at the beginning of this presentation. So next slide. So strategies for addressing vaccine hesitancy. A lot of us know those folks in our community, our friends and family, who are not anti-vaxxers. They're just hesitant to get the vaccine. They haven't received the information that they're looking for. They haven't heard it from reliable sources. So if you've been vaccinated, if you understand the importance of vaccination, either through this talk or all the other talks that have been through this platform, I encourage you to use these strategies. So first, when you're talking to someone, you just want to, announce that COVID-19 vaccine is out there and that they're eligible for it. You want to endorse it. You want to tell them that you got the vaccine and tell them about your experience. You want to educate them, focusing on the benefits of the vaccine. And we've talked about all of those things around hospitalization and preventing long COVID and potential diabetes and all the things that go along with our children being able to get back to having some sense of normalcy. Respond to their questions. We have lots of questions that are out there. I'm hoping people will ask questions today so that we can respond to those questions. But if you're educated around COVID-19 vaccine, I encourage you to answer questions, be open and honest with people. Also to assess your family member or your friend's readiness. Some people just aren't ready, but that's okay. I encourage you to continue to persevere, continue to talk to them, continue to encourage them and help them along in their journey to getting vaccinated against COVID-19. So Mark Davis gave this quote: "Vaccines are the single most life-saving innovation ever in the history of medicine. Vaccines save 2 to 3 million deaths per year." And so when I start thinking about COVID-19 and where we are with our vaccinations and how far we have to go with vaccination, I start thinking about what is my role in all of this? Where will I be when history writes this story of COVID-19? What will my great-grandchildren say about my generation and how we handled COVID-19? What did I do to protect my community? And the most important thing that I can do is to educate, to be there for friends and families and talk to as many people in our community about what's really going on in our community, how we're affected by COVID-19, and how we can prevent COVID-19. And so with that, I'll take questions.
Wow, that was a wonderful presentation, and it really kind of gave some perspective to how long we've been dealing with vaccines and how long vaccines have been around, and bringing the history forward, bringing it all forward and talking about how we're learning. And each time we develop a vaccine, we're learning and we're making them better, which is why we were able to create this vaccine. I'm saying we, in terms of in a general sense, able to develop this vaccine in a short amount of time. So let's address some of the concerns.
Okay.
So first question I'm going to ask you, are all of those different diseases the same?
So no, those different diseases are not the same. Some are viruses, some are bacteria, some are spread through close contact, some are spread through respiratory droplets. And so each vaccine is designed specifically for that disease. It's so important for us to understand that in the midst of COVID-19, we had a significant decline in routine immunizations, up to 26% in some areas. So not only are our children at risk for COVID-19, we have increased risk for those routine diseases that we typically vaccinate against, just because our children are under immunized at this point. So not only talking to your friends and family members and understanding that you need to get vaccinated against COVID-19, if your child has not seen their doctor in the last year, you need to check in with them and be seen, because your child may be due or be behind for some childhood vaccinations. And so they may be at risk for things like measles, mumps, rubella, those things that we talked about.
What do you think is the biggest contributing factor to making people think that this vaccine is somehow different than other vaccines? Because you detailed in your presentation, children get at least 14? You said 14 vaccines by the time they're
the first 6 years, they'll get 14 vaccine components,
14 vaccines,
multiple doses of those.
And most of the time, with a small percentage of anti-vaxxers in that sense, most of the time kids get those vaccines no problem. What do you think is the factors that are contributing to people really setting this particular vaccine separate from those other 14 or 15 vaccines that we get in our lives?
I think it's significant misinformation that was put out and gained a lot of traction through social media and other news outlets, and just not having access to the information. I also think it's part of how we've seen science play out in real time. Most
Right.
people don't get to see that, and so don't understand the process that science is not the truth, it's finding the truth. And
Right.
so getting through that and working the process of finding the correct answers. And so as the virus was developing and going through the world and infecting people, we were having to learn. It was a novel virus, meaning it was brand new. So having to learn what worked and what didn't work. And so what people thought as us getting it wrong or giving bad information or not telling them the truth was
Right.
really just science playing out, for the world to see.
Right. So I'm trying to avoid asking the question why, because that goes into somebody's intent, and so we can't get to that deep into intent. However, I will ask this question: What do you think? What do you think people are? How do you think people are really focusing more on potential impact of the vaccine and not the potential impact of long COVID, even if they survive COVID? Right. So we know, I mean, because somebody posted a comment, and I'm giving you the background of this. Somebody posted a comment that said children have a 99.93% chance of recovering from COVID. Okay. So if that's true, I don't know, I haven't verified those numbers, but if that's true, that means that this person is okay with 0.07% of children dying from a preventable disease. So that's the first thing that I have a problem with. The second thing is that of that 99.93% of people that's assuming that of children that catch COVID, you describe long COVID symptoms and conditions that could last throughout their lifetime: diabetes, hypertension, heart, memory problems. In adults, we're talking about erectile dysfunction. We're talking about other problems that can develop as a result of long COVID. What's the reasoning behind people being more focused on potential effects of a vaccine versus the effect of catching and even surviving COVID?
So I think it just goes back to, again, misinformation, and people fear what they don't know. And so getting out the proper information to our community, understanding, again, like I talked about, it's not just about our children surviving COVID, it is about them thriving in the midst of COVID. And they can only do that if they don't have long COVID, if they don't have complications from MIS-C, and understanding that MIS-C is one of those things, it's a disease that can come along 5 to 6 weeks after having COVID. And in some cases, the child was completely asymptomatic from COVID. And so the parent was not concerned about their case. They were just tested because they were exposed, asymptomatic COVID. And then a month later, they develop this debilitating disease that can kill them or leave them with significant disease or issues with their heart and organs for the rest of their life.
Yeah, and I think that's where the misinformation is causing the most harm, because people are equating, because the symptoms of COVID are similar to the flu, that people are equating that, hey, once I get over it, it's like the flu, where the flu typically goes away. And that's why I asked the question, are they similar? Because the flu, even though the flu and COVID feel the same, their course and the way they impact the body are not the same over time. And so we have to recognize that each one of those illnesses, that's why they each have their own vaccine for them. Each one of these illnesses are different, and COVID is different. That it's mutating at a faster rate, and it's getting into our bodies, and it's having a longer impact, because some of the things I've read, and stop me when I'm wrong, is that COVID is a more vascular illness. I know, even though I know the Delta variant was attacking people having a hard time breathing, but it's a vascular illness. And so that's why it's impacting all the organs and having some significant problems, because it's getting into your blood. Vascular meaning, blood in your vessels for those that are watching. And so that's why it's having a much more longer impact on our bodies. And so a couple of rapid fire questions as we're wrapping up our time. If for young ladies, will the vaccine have any impact on their ability to have a menstrual cycle or have children?
It absolutely does not affect your fertility. In fact, what we found is data shows that getting COVID-19 in males actually can affect your fertility negatively. So getting vaccinated is what can prevent you from having fertility issues later on as a male. For women, it's so important to be vaccinated, especially if you're in that childbearing range, because you can have significant complications if you get infected with COVID-19 while you're pregnant, not to mention giving COVID-19 to your newborn.
What range can children get boosted if they've been vaccinated?
So children who are 12 and above are now eligible for a booster, and that would be 5 months after their second vaccine. So it's so important, especially in the midst of Omicron, getting your booster gives you a 97% chance to not be hospitalized from the Omicron variant. And right now with Omicron, we're seeing the largest amount of pediatric hospitalizations in the history of this virus. Before, we were talking about it didn't touch our children. We had very few hospitalizations. We are seeing children being hospitalized at numbers that we have not seen prior to in this pandemic now with the Omicron variant.
And here's the biggest piece of misinformation that I see continue to circulate. Do the vaccines prevent you from becoming infected?
So nothing is 100%. And that's part of why, we went through all of those different vaccines so you could see how effective they are. So when the COVID-19 vaccines came out, we talked about Pfizer and Moderna being 95% effective against COVID-19. That still meant you had a 5% chance of getting COVID-19. But what we need to focus on, it's not just about not getting infected. It does significantly decrease your risk for getting infected, but it keeps you out of the hospital and it prevents death. Those are the things that are affecting our community so much more disproportionately than other communities. It's loss of income, it's loss of life. Even those children who have lost a parent or a caregiver can sometimes not go to a family member because they've now lost their income because they were hospitalized with COVID, or they've lost their job. COVID has so many secondary and tertiary effects on our community that, our children, it will affect our children for generations to come.
Yeah. Yeah. And another big thing is that that I keep seeing circulate around is that the more severe reactions to COVID have come with people that have comorbid conditions, hypertension, diabetes, multiple health conditions prior to getting COVID, and the COVID caused the complications and they're dying. And so there's a group of people saying that we should focus on getting healthier and not getting vaccinated. What is your response to that?
So as a physician, don't get me wrong, I'm all about getting healthier. But getting healthier takes time that a lot of people, the 1,200 people dying a day in the United States, do not have. So getting vaccinated and preventing the spread is what we can do to prevent those deaths now. And then we can talk about what can we do to get healthier. In the midst of this pandemic, record numbers of people have gotten out and exercised and watched their diet. And I hope that continues.
Right.
But that is not our way out of this pandemic. Our way out of this pandemic is stopping the spread, and that is vaccines.
Yeah, I wrote a piece on that recently, and what I said was it's not an either or, it's a yes and, right? And so we've got to take a yes and approach. So yes, you should start taking your vitamin D, because we know most of you, and especially in Black and brown populations, vitamin D is typically low. Yes, you should be getting your blood sugar and trying to find ways to lower your blood sugar. Yes, you should be trying to lower your blood pressure. Yes, you should be trying to lose weight, stop smoking, all of those things, and get vaccinated. So we'll take a yes and approach to all of this, what's going on. Final question. I know we're starting, we're rounding that corner, heading to spring and summer. And we know that we've realized over the past couple of years that rates typically go down when it gets warmer. Hopefully, do you expect us to have that same kind of pattern this year where it goes down and then back up as we get cooler? Or hopefully we'll have enough people vaccinated by then that we don't have to see that spike that we saw this last winter?
So that will depend on what we do over these coming months. We're definitely seeing rates decline with Omicron very rapidly. And so now is the time to go get vaccinated. That misinformation around, if I've had COVID, I'm immune, I don't need to get vaccinated. Yes, you still need to get vaccinated because you will have waning immunity. So while we may have some short-term pseudo herd immunity, because we've had so many people get Omicron. Do not let your guard down. Do not think that you're going to be protected long term. The only way to do that is to get vaccinated and boosted. And so getting in our community and talking to everyone that we can talk to about the importance of now is the time. Because if we continue to allow COVID-19 to spread, it will continue to mutate and we will be back in this position again. So we have the power to prevent that through vaccination and helping those get educated and vaccinated.
Wow, this has been just very informative. Will there be a third booster? You've had COVID twice. So there's a question. Will there be a third booster? So if you've had COVID twice, I would say monitor your health. And if you are completely COVID free, get vaccinated, because that will help reduce some of those long-term symptoms that you could potentially be impacted by because you've had COVID. So the jury is still out, just like Dr. Brown was saying earlier in the presentation. We're doing science in real time, right? And so while we're vaccinating people, we've got enough information that we know that the vaccines are safe and they're effective. Science changes, right? As we get more variants, as we get better, at learning how this virus works, we can get better vaccines. There are some companies that are developing an oral treatment right now to COVID. So if you get COVID, you can just take a couple pills, and almost like what you do with the flu. So we're getting better, but I would say that definitely monitor your health. Keep a check on that. You can get some home, blood pressure kits, all of these things that you can check on your own to monitor your health. There are some, the president of Pfizer said we probably will be getting another booster. It probably will require another booster in another 5 to 6 months after your booster, because it is a waning immunization, and getting boosted does help, right? The numbers support that. So get boosted if you can. If you know somebody's been vaccinated, tell them to get boosted. It doesn't matter which shot you get in terms of which booster shot. So if you got Johnson & Johnson on the one shot, you can get a Moderna or Pfizer booster shot. It doesn't matter. And in some cases, they're saying your immunization response is even better. So finally, I will say is that, we're talking about the South. We got Dr. Brown from Alabama. I'm in Georgia, from Florida. I did a quick search when people were talking about health conditions. I did a quick search on the 10 most unhealthiest states in the union, with the exception of one, and that was in a Midwestern state, Indiana. All of them were in the Southeast. Mississippi, Arkansas, Louisiana, Alabama, South Carolina, all of these states, Oklahoma. So when we're talking about, and those are the states that have the lowest numbers of vaccination rates and the highest number of cases and deaths. And so if you live in any one of these states, if you live in the southeastern quarter of this country, please get vaccinated. Don't complicate it. If you already have a medical condition, diabetes, hypertension, please don't complicate it anymore by not getting vaccinated. Okay? So go get vaccinated and then work on whatever other medical conditions you have, but simultaneously, but don't not get vaccinated, because it can become deadly. It can be very deadly for you or somebody around you if you gave it to them unknowingly. So we went over our hour. We could be talking more about this. So good job, Nat, getting boosted. And so thank you again. We're going to be back here tomorrow night. We got another doctor, another presentation, because we are all about getting you the information you need. Tonight was all about, vaccines and kids. We had a pediatrician on. Tomorrow we're going to be talking about adults and what we need to be, all that we need to be doing in terms of getting ourselves safe and staying protected. So thank you for joining us. If you have any questions, leave them there. We'll go back and read them and answer your questions as much as possible. Go to visit blackdoctor.org. We have a COVID-19 resource center right there on our website page, so you can get all of the latest COVID-19 news there on our page. So thank you again, and we will see you tomorrow night.